Hello, this is Nelly. Welcome to my channel. Today I'll be talking about pap smear. We're going to talk about what is pap smear, who needs a pap smear, and why do they need a pap smear. So a pap smear is a screening test that is used to screen for cervical cancer. So who needs it? Any woman ages 21 to 65 can get a pap smear screening test done to them. And why do they need this? Because that screening test, the pap smear, is what is used to determine if you have cervical cancer or you are prone to having cervical cancer. So from 21 years old to 65, you are recommended to get a pap smear every 3 years. So every 3 years you can visit with your primary provider and request for a pap smear screening to be done to you. But if you are older than 30 years old, so 21 to 30, the frequency is every 3 years. From 31 all the way to 65, you have two options. You can either keep the routine every 3 years, or you can check with your provider and ask for a HPV vaccine. If you do a HPV vaccine and your pap smear together, the frequency changes to every 5 years. And that's an option that is available for only women who are 31 to 65. If you don't want to do the HPV vaccine, you can just keep your regular routine of every 3 years. So I will repeat. Women from ages 21 to 65 can get an women ages 21 to 65 can get their pap smear screening done. Okay? And the routine is every 3 years. But if you're older than 30 years, so 31 all the way to 65, you have an option of either doing the 3 years routinely or getting your pap smear and your HPV vaccine together, and that changes the frequency to every 5 years. Okay, so both the pap smear, it's a screening that helps to test for cervical cancer in the cervix. So how is it done? So when you visit your provider or your gynecologist, they'll use a special instrument or device that I think it's called speculum. It goes in your vagina, and once it goes there, it opens up, and they can go in with a special brush and get some cells from the cervix. Cervix is the entrance to your uterus. So they will go all the way in and swab it in and get all the tissues and all the cells around your cervix, and that is what they send to the lab to run the test on. And from that test, they can detect whether you're prone to having cervical cancer or you have some cervical cancer already growing in you. So that way they can be quick to start treatment or decide or see what else to do. Or if they find that the cells are abnormal and they want to keep an eye on it, they can say, oh, we're not going to wait every 5 years, or we're not going to wait for every 3 years. We want to see you every year to make sure that this abnormal cell is not turning into cancer or it's not getting worse. So that is why we do these screenings. These screenings are done so we can catch things early. We can catch things early and try and fix them on time. All right. So today we've talked about pap smear, what is pap smear, who needs pap smear, and why they need pap smear. And in the process, I've also introduced an HPV vaccine. So HPV is human papilloma virus vaccine. In this country, people as young as 9 years old, 11 to 12 years old, they can get a HPV vaccine. And HPV vaccine is not just a woman's vaccine. Both men and women, boys and girls, can get an HPV vaccine. All right, and it helps with the genital warts, to screen for genital warts and to prevent genital warts, which make you more prone to cervical cancer. So that's why they do that. All right, so my lesson today is pap smear, what is pap smear, who needs a pap smear, and why you need a pap smear. So make it a point to see your provider, your primary provider. Check with them, ask them, am I due for my pap smear? Can I make an appointment to come and get my pap smear or my HPV or one of those? You have to be a proactive patient. You have to be self-advocating for yourself. The doctors they're good. The officers will call. Some officers will call you. They will remind you. But they're seeing a lot of people. So you want to be that patient who is proactive. You want to be that patient who is self-advocating, who is asking, doctor, am I due for my annual labs? Am I due for my physical? Can I get a colonoscopy? Am I due for a pap smear? Can I get a referral for a mammogram? Don't just wait for the doctor to be the one following you for these things. I'm here to give you those reminders, to tell you the things that you need to check with your doctor, to give you that reminder that, okay, go ask them about your labs, ask them about your colonoscopy, ask about your mammogram, ask about your pap smear, and all these things. All right, so that's why I have this channel, to be a reminder for your healthcare needs. All right, and disclaimer, I am not a doctor. I'm just here to remind you and to share tips with you, ideas that when you go to see your primary doctors, you have pointers on things to ask and things to get more information about. All right, so thank you very much. Have a blessed day, and I'm looking forward to see you on my next video. Bye.